Hello, I'm Reinge, an APOS trained physiotherapist with Reinge Clinic in Kenilworth, and in this video we're going to talk about how the APOS shoe can help with osteoarthritis of the knee. When we're talking about arthritis of the knee, we're talking about wearing or damage to the cartilage which stops bone rubbing on bone, which stops areas of the knee that shouldn't come into contact with other areas of the knee doing so, and gives the knee a whole smooth operation. When that starts to wear down, we get pain. Now, traditionally, there are a lot of physiotherapy exercises that we use to try and redistribute the forces, to try and change the way the knee behaves, and quite often that's successful. But what happens when you're not responding to the traditional physiotherapy? That's where the APOS shoe comes in. When we move the pods on the bottom, we can change the forces that act through the knee and the way they act. So for example, you might find that you shorten your stride up because when you put your leg out in front of you, the knee joint is quite closed, and as it touches the ground, as your foot touches the ground, you get Newton's third law, opposite and equal reaction coming back up against you. And without the correct arrangement and the correct amount of cartilage and fluid in the joint, that can be painful. Well, we can help that by moving this pod backwards, which means that your foot hits the floor sooner, which means it hits the floor before the knee is fully locked, and that in itself can relieve the pain. If we move the pods sideways, we change the way that the forces go up through the femur and up into the knee, and again we can create space that can stop the pain from occurring. And most importantly, this isn't just about stopping pain, it's about trying to normalize your gait, making sure that you load both legs equally. And that's what this is really very good at, allowing you to load the arthritic leg in a way you wouldn't load it if you weren't using the shoe. And we can partly achieve that through these spacers, which bring the pods further away from the bottom of the shoe and change the way you load your leg. Loading your leg correctly and keeping your gait normal will stop you favouring the good leg, or if that leg has a little arthritis too, will stop the arthritis getting worse in the opposite leg also. So it's very little to lose by trying these. And of course, when you're tested for these, it's absolutely free. The whole test lasts about an hour and a half, and it will either work for you or it won't. It's as simple as that. So if you're interested, give us a ring, and hopefully we'll see you soon. Take care.